Dear students, today we are going to learn about anatomy and physiology. A very brief introduction. Anatomy is the branch of bioscience which deals with the structure of the human body. Physiology is a branch of medical science which deals with the functions of the human body. Anatomy and physiology cannot be separated. Both go hand in hand. Today, we learn about the main important unit of the body, that is cell. Cell is the structural and functional unit of the body. There are millions of cells present in our body. Many cells together makes tissue. Many tissues together make an organ. Many organs together make a system. Many systems together works harmoniously and they make the human body, which helps for all the activities of the day-to-day life. Today we are going to learn about the skeletal system. The skeletal system is divided into two groups, axial skeleton and appendicular skeleton. If we go to see the functions of the skeletal system, the functions are: it provides the structural framework of the human body, it gives attachment to the muscles and tendons, it allows the movements of the body, especially where the muscles and the joints are attached. It also forms the bony prominences like cranial, orbital cavity, thorax and pelvis, and it protects all the organs that are present in it. The main functions of this system is also erythropoietin. It is the blood forming cells that are present in the red bone marrow. And the other important function also is mineralization reservoir. Here the calcium and phosphorus are stored, which helps us for the calcium and the phosphorus help for the bones, life and activity. If we go to see the structure of the skeleton, their bones are classified in 5 groups. They are long bone, short bone, irregular bone, flat bone and sesamoid. The example of long bone is the femur and humerus, radius, ulna, tibia, fibula. The short bones are carpal bones of the hand. The flat bone is sternum as well as some of the bones of the skull. The sesamoid bone is the patella. Now, the bones are divided according to their part. That is, the outer layer is composed of dense tissue. They are known as compact. The outer layer is protective layer and it is tough and hard, which is called periosteum. The inner aspect of the bone is formed or constituted by the spongy tissues, which helps for the production of the blood cells and many other aspects. The nutrient artery, one or more, are supplying the blood supply to the structure of the bone. Now we are going to learn about the skeleton. The skeleton is divided into 2 groups, axial skeleton and appendicular skeleton. Axial means axis. It is the core of the body. Axial skeleton consists of the skull, vertebra, ribs and the sternum. This part of the bones represent the axial skeleton, and this part of this table represent the appendicular skeleton. Appendicular skeleton consists of the shoulder girdle, pelvic girdle, the bones of the upper limb and the lower limb. Now we see the skull. There are total 206 bones in the body. The skull rests on the vertebral column at the upper aspect. The skull is formed by the 8 bones. This is the upper portion. It is a vault-like structure. It is known as cranium, and the front portion is known as face. The 8 bones of the cranium, the front one is a frontal bone. On the top, sidewise, and the roof making by the parietal bones. The posterior aspect is formed by the occipital bone, and the 2 lateral side, the temporal bone. In the inner aspect, there is sphenoid and ethmoid bones. The facial bones. There are 13 facial bones present. 2 lacrimal bones, 2 nasal bones, 2 zygomatic bone, that is also known as the cheekbone, 2 inferior concha, 1 maxilla, it is also known as upper jaw, 2 palatine bone, they are L-shaped bones, and 1 vomer bone which is inside at the interior aspect, and 1 that is the mandible, that is the only movable bone in the skull. Now we see the suture. Suture means when 2 bones join together, it makes a suture. This is called the coronal suture. The coronal suture joins the frontal bone with the 2 parietal bones. The sagittal suture joins the 2 parietal bones. The lambdoid suture joins the occipital bone with the parietal bones, and the squamous suture that joins the temporal bone with the parietal and little portion of the frontal bone. There are 2 membranous area. At birth, in the fetus, at birth, the baby, when he or she is born, the bones are not ossified completely. This allows the molding during the childbirth. So there are 2 main membranous areas. This is the anterior, that is known as anterior fontanelle, and there is a posterior fontanelle, that is also known as lambda. It is a triangular shape, and this ossifies at 1.5 months. The anterior fontanelle is of diamond shape, and it ossifies at 1.5 years or 12 months to 18 months. Now we see the vertebral column. There are 26 vertebrae present in the vertebral column. This is the first vertebra, that is known as atlas. Atlas is very small. It has a typical structure. It has no vertebral body, but it is a ring-shaped structure. There is a vertebral foramina. Through this, the spinal cord passes. There are spinous process through which the nerves and the arteries passes, and the posteriorly there is a posterior tubercle. The second vertebra is axis. This is the only vertebra. It has got the odontoid process, a dense process that attaches to the atlas at the inferior border, and thus allowing the movement of the head from up to down and the sidewise, right side and the left side. There are 7 cervical vertebrae. This is the structure of the cervical vertebra. 3, 4, 5, 6, 7 are the cervical vertebrae. This is the vertebral body, vertebral foramen through which the spinal cord passes. There is a transverse process right and left. Also there are transverse foramina through which the arteries and nerve passes, and posteriorly there is a spinous process, but in cervical vertebra it is known as bifid process because it is like two wing structure. After 7 cervical vertebrae, there are 12 thoracic vertebrae. This is the structure of the thoracic vertebra. In the vertebral body, it is bigger than the cervical vertebra. The vertebral column, the foramina, is little smaller than the cervical vertebra. There is a transfer process both the sides. There is a pedicle, the lamina that attaches the spinous process with the transverse process, and this is the spinous process in the thoracic vertebra, which is long, elongated. This is the lumbar vertebra. There are 5 lumbar vertebrae. The vertebral body is more dense and heavy because the weight of the body of the upper part falls on the lumbar vertebrae. There is a vertebral foramen through which the spinal cord will be passing through. These are the transverse processes. This is spinous process. It is dense and thick and short. So in short, the cervical vertebrae are 7, thoracic vertebrae are 12, lumbar vertebrae are 5. Cervical vertebrae are smaller in size, thoracic vertebrae are medium in size, and the lumbar vertebrae are bigger in size because it bears the weight. Now, below the lumbar vertebra, there is known the sacrum. Sacrum is a 5 fused vertebrae together forms a sacrum. So the lower border of the lumbar vertebra attaches to the sacrum. Between 2 vertebrae there is a disc so that the friction will not allow the injury to the vertebrae. This is called the sacral promontory. This is the ala of sacrum, both the side, and this will attach to the ilium of the pelvis. Look at the inferior border. Sacrum is attached to the coccyx. Coccyx is also known as the tailbone. There are 4 fused vertebrae in the sacrum. Therefore, there are 26 total vertebrae which we have divided: 7 cervical, 12 thoracic, 5 lumbar, 1 sacrum and 1 coccyx. Now we go to the chest. This is known as the chest bone or the sternum. This is the clavicular notch, right side and the left side, and this is called jugular notch. It is divided into the 3 parts. This is the manubrium, body, and the tail is known as the xiphoid process. Now there are 12 pairs of ribs. There are 7 pairs which are attached directly to the sternum. They are known as true ribs. There are 3 pairs, 8, 9 and 10. They do not attach sternum directly, but indirectly they are attached to the sternum. So they are known as false ribs. And there are 2 ribs that are attaching. 11th and 12th attaches only at the posterior aspect of the thoracic vertebra. This is the clavicle bone. The clavicle bone lies horizontally in this way, and then it attaches to the clavicular notch, and the other end attaches to the acromion process of the scapula. The first rib is a small and broad. The other ribs are, as it goes down, it becomes thinner and then longer. This is the costal aspect or costal surface of the rib, This is the costal surface or the depression. This is the head of the ribs, neck of the ribs, and then the tubercle. So, we have seen the axial skeleton, the skull, vertebral column, the ribs, the sternum, the ribs. This is called the axial skeleton. Now we go to the appendicular skeleton. Appendicular skeleton consists, as we have seen, the last portion of the vertebral column, that is the sacrum and the coccyx. They are attached to the innominate bone. This is the innominate bone. This is one innominate bone. When there are two innominate bone joints posterior to the sacrum and the coccyx, it makes a pelvis bone. It is also known as hip bone. So now we will learn about the innominate bone. The innominate bone. There are two innominate bones in our body. It is divided into three main bones: ilium, ischium and the pubis. The upper border of the ilium is known as iliac crest. This is anterior superior iliac spine, anterior inferior iliac spine, posterior superior iliac spine, posterior inferior iliac spine, greater sciatica notch, ischial spine, lesser sciatica notch, ischial tuberosity. This is the obturator foramen. This is the acetabulum cavity, which at the head of the femur attaches and it forms the hip joint, which allows all movements, that is adduction, abduction, flexion, rotation, etc. Now we will see the femur. The femur is the longest and the strongest bone of the body, which bears the weight of our body. This is the head of the femur, this is the neck of the femur, this is anatomical leg, this is the surgical leg. This is a greater trochanter, lesser trochanter, the intertrochanteric line. Linea aspera, this is the lateral condyle, medial condyle, superior lateral condylar ridge, medial condylar ridge, and here is the attachment for the tibia. It is the lower extremity bone. So the femur attaches to the tibia in this way. The patella is a sesamoid bone. It will attach anteriorly to this aspect. Now we see the tibia. Tibia, as I have said, this is the attachment for the femur. This is intertrochanteric eminence. This is the protrudence, or this is the tubercle. This is called the shaft. And here this is the malleolus process. This is fibula. Tibia and fibula are attached in this way. This is the shaft, and this shaft is covered by the interosseous membrane. The malleolus process in the fibula. Here is the head and the neck of the fibula, and this is the one of the long bone. Now we see the tarsal and metatarsal. The tarsal, the calcaneus, attaches in this way. So the tibia attaches to the surface of the talus, and then the connectivity goes on. There are 7 tarsal bones: talus, calcaneus, navicular, cuboid, and 3 cuneiform. There are 5 metatarsals: 1, 2, 3, 4, 5. There are 14 phalanges. They are 2 in the great toe, and 3 in each toes. So 3, 6, 9, 12, 13, 14. Now we go to the upper arm. This is the shoulder girdle, or it is also known as scapula. Scapula, we have two in our body, right scapula, left scapula. The scapula has 3 borders: superior border, medial border, lateral border. It has got 2 angles: superior angle, inferior angle. At posterior, there is one protruded portion, it is known as spine. There are 2 processes, acromion process and coracoid process. There is a suprascapular notch. The spine divides the scapula into supraspinous fossa and the infraspinous fossa. There are 2 surfaces. This is called the costal surface and this is called the dorsal surface. The humerus, it is the bone of the arm. The humerus attaches in the glenoid cavity of the scapula. This is the round-shaped cup cavity, that is a glenoid cavity. So the head of the humerus attaches in this way and allows all the movements possible, that is flexion, extension, rotation and circumflexion. This is humerus. This is the right humerus. Head of the humerus, neck of the humerus. There is a bicipital groove. This is the deltoid tuberosity. Here the deltoid muscles are attached. This is called the capitulum. This is the lateral aspect and the medial aspect. Here the ulna joins in the coracoid process and then makes the elbow joint. So this is the way the ulna attaches to the humerus at the posterior aspect and allowing the movement of these bones, and that is called the hinge joint. This is the upper aspect of the ulna. Here is the tubercle, this is the shaft and this is the styloid process and this is the head of the ulna. Here we have the radius, this is the head of the radius, this is the radial tubercle, the shaft and then here is the styloid process. So both the bones together in this way makes the bones of the forearm. The lateral aspect is the radius and at the middle aspect or the inner aspect is the ulna. Now the ulna, both the bones are attached to the carpal. There are 8 carpal bones. They are the short bones of the hand. They are divided or placed into the 2 rows, the proximal row and the distal row. In the proximal row, scaphoid, lunate, triquetrum, isiphon, trapezium, trapezoid, capitate and hamate. These are 8 carpal bones. There are 5 metacarpals, 1, 2, 3, 4, 5. And there are 14 phalanges in the thumb. There are 2, 1 and 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. So they are at the proximal end and then the distal end attaches to the metacarpals and these are the phalanges. So here total only one bone that is not attached to any bones, that is the hyoid bone, that is situated, it is isolated bone and it is situated above the larynx and below the mandible. So in short, I have told you about the 206 bones of the human body. Thank you.